Greetings, everybody. We are live again this evening with another segment, D Live, the Convo series. We're going to give it just a moment or two for some folks to pop on here. But when we get ready to roll momentarily, we're being joined by Dr. Angelica Hardy this evening, which is a great honor. She's super busy, and so we're glad to have her here, taking some time out of her busy schedule these days. I think this is a real important conversation that we're going to have, because one of the things that we're seeing in this process of COVID-19 and the coronavirus is how it's really impacting different segments of our community differently. Why is that? What does that look like? What are those impacts, and what can we do to begin to address some of these things? And so that's a little bit about what we're going to talk about. First of all, we want to hear about her background, how she got here. She's so passionate about public health and public health policy. First of all, she's super cool because, like me, she's originally from the east side of Cleveland. And so we connected on that right away as well. And then I think you came down here to go to school at UC and went on from there. But first of all, Angelica, thank you so much for joining us this evening. I really appreciate you being here.
Thank you for having me. I'm really excited for this conversation.
Awesome. So can you just kind of lead us through your background? First of all, just to jump ahead a little bit, you have 3 degrees from the University of Cincinnati, all in public health policy. You're now employed by the American Heart Association as Vice President of
Health Strategy.
And so basically you've dedicated your life into public health and all of the aspects of that. And you've studied it and involved in many different ways. Growing up in Northeast Ohio, can you tell us a little bit about that and maybe how you become so focused on this and so passionate about it?
Yeah, I reflect on that a lot because I'm like, how did I get here in the midst of the pandemic? Like, I know this was going to happen, but I think it started with my drive. My family's really oriented to volunteering. And I didn't even know volunteering and being in public health was a career at that point. So I grew up serving the community. It was like normal to me. My mom worked for the Urban League of Greater Cleveland when I was a kid. And so I would go to all of the workshops and all the classes and programs that they had. I would go to work with her all the time. So that was like a normal thing for me. So that continued on into when I thought I wanted to be a physical therapist, but then I got to UC, and then I did sports medicine and loved it, but I fell in love with my public health classes. So I think it was that combination of like serving the community and the interest in health combined, that's where the spark came from. So I was always interested in serving, but I didn't know like in what way.
Right.
When I found that, everything kind of just clicked, and then I decided to go to school for a really long time.
And there's so much involved with that. Obviously, a master's program, a PhD program, and then as part of that, you've been able to also travel the world and see. And from this, studying pandemics is actually something that you focused on, right? What did that look like? Where was that?
Yeah, so I studied abroad in Belize, Ghana, and China. And when I had my study abroad programs, they were typically more tailored on a specific topic. So HIV and malaria at one point, tuberculosis. And then one, I was actually studying like the healthcare system and how the system itself worked when I was in Chongqing in China, which is crazy to think about now as we and then I also had an opportunity to work for the Centers for Disease Control and Prevention. And at that point, I was actually monitoring MERS-CoV, which was in 2014 or 13, which no one's ever heard of. But to think about how I was able to learn at a very early age in my career about pandemics and how you work and how we monitor and how we contact trace. I laughed because I texted a friend today, like, I learned about this, but this is not what we expected.
Yeah.
We trained for this, but it's a lot different than the reality of what we're currently going through and how coronavirus, or specifically COVID-19, is literally transforming before our eyes. So those things definitely prepared me to be here, but it's still not by a textbook as we hoped. We weren't able to kind of nip it in the bud that we have been able to come up with vaccines, get treatments very fast prior to.
Right. And so that's something that I find very interesting. That you go from studying these things in different places, and here now it's hitting obviously very close to home. Many people are suffering, and not only from the physical, the folks that are sick, the thousands of people that have died, but also now the economic fallout from that is impacting a lot of people. And so now we see, how important this is. It's not just something that's occurring off in some faraway land and it doesn't really impact us. It's impacting the entire globe right now, which is kind of crazy to think about. But with that, I wanted to just mention we've got a number of people jumping on here and leaving comments, which I really appreciate. Please do. Glad to know that you are here and joining us. If you have any questions, please add them in the comments, and I will keep an eye on those, and we will do our best to get to them, maybe perhaps towards the end or as we go. And so with that, I just want to touch on there's a number of topics we want to get to, and maybe we'll touch on a few more out of the questions if we get any. But one of the things I want to talk about, and that we see, someone who's been engaged in civic life here in Cincinnati, and looking at in the city of Cincinnati, we have over 40 some percent of our population is African American, and the disparate outcomes that we've had for a long time, quite frankly, and we don't have to get into all the systematic, reasons for that. I think a lot of folks are familiar. If there's any that maybe don't, haven't met the eye that you'd like to mention, we'd like to hear about that. But now also kind of bringing that up to the current situation, what are some of the background here in terms of our low income and minority communities? We're seeing where in the state of Ohio, it's 13 to 14% African American population in the state, but 21, 22, 23% of fatalities from COVID-19 are African American. What is the difference? And tell us, some of the backgrounds. I hear the term social determinants of health. Tell us exactly more what that means and how that all applies.
Yeah, and I'll first start with, you're right, the systems, right? This is COVID-19 and this is happening and we're seeing it, the horrible impacts of this disease, but the implications of the systems that are created were way prior to then COVID-19. We've been here before. We actually probably knew this would happen, not in this way, but the systems were not created for minority and low-income populations to thrive. And when COVID-19, this is the first, not the most, the largest impact is in this population. So as you mentioned, that's right. With social determinants of health, or social influencers of health, community conditions, all those terminologies really are the things that impact our health. Sometimes we go 40, 60, 80%. You can see it different in different publications. Are things actually outside of our health care and outside of our eating 3 meals a day and a healthy diet? There are our environment, there are education, there are economics, there are all of those things that indicate our health that are outside of our physical health and, okay, exercise every day and eat healthy. They're really the conditions that are outside that influence and actually impact our health greatly. And now that we see COVID-19 come in, we see how it's impacting our communities, and specifically with cardiovascular disease, diabetes, hypertension, all of those things being complications and those comorbidities of COVID-19. We are seeing them impact the communities that are also impacted by social determinants of health, right? So when we talk about living in food deserts and and being food insecure, we see that correlation between those communities. And then when we have suggestions like social distance, if you feel ill, use a different bathroom. Those are the type of things that we hear come up. Be by yourself in a room, but that may not be an opportunity for all of our neighbors and all of our community members. So thinking about these suggestions that also breed privilege in the sense, right? If you are able to say, I'm only going to use this bathroom, I'm only going to be stuck in this room by myself, I'm able to social distance and social isolate if I'm ill, or that's not even a possibility for me and my family. So thinking about those things has a huge impact on us in COVID-19 and social determinants of health.
And So I think about a number of different things, and some of them you mentioned, some more, even the bigger picture. We look at, other states, particularly in the South, southern states, and of course, you're going back to, the times of slavery, and how there have been, political systems in place
Hmm.
have not advantaged uh, African Americans, even more so, depending on where you're at,
Hmm.
what states. So, for example, perhaps a state like South Carolina, where the government doesn't accept expansion of Medicaid dollars from the federal government. And so, and different things like that. You mentioned food deserts. One of my big issues is transportation. People even have access to get to, you know, doctor's appointments and things like this. And all of these things compile and build up over time to create these, worse, just general situations, so that when, something like this does hit, it just expands upon that, kind of magnifies it. So
Yeah.
if I'm already weaker or to have a tendency to be more ill, then clearly this virus, if it strikes a young healthy person that has everything else going for them, they're probably going to be okay. But for me, it puts me at greater risk, and then that manifests itself in these differing statistics in terms of the deaths and those types of things. I mean, am I on track with that? Does that make sense?
You're totally on track. Yeah, it's like this was already happening, and COVID-19, you know, unfortunately, has gravely impacted, and it kind of exacerbated the mortality impact that these social determinants of health were having on our communities.
So, as a takeaway from that, what are some things? What are some things that we can do, perhaps from a policy perspective, whether it be on the national level, the state level, or the local level? And we can talk about it. And of course, the first step to solving a problem is recognizing that there is one. And
Yeah.
then secondly, what's the prescription for this illness, if you will? Um,
Well, start
how
with the
does this
policy.
work?
I have to start with the social distance, right? I want to start with that at first. Wearing a face mask and social distancing. Before we were talking today, there's still so much unknown and so much that's CDC, was it today, this morning, or I got them last night, that they've added symptoms. So just that, I think, is the beginning. When coming to a policy standpoint, I think we also have to continue to be flexible in our policy standpoint. We know that contact tracing works, and they have also started, I know, hiring a lot of contact tracers in public health and making sure we are able to identify where people go, where have they been, how to get in contact with people earlier, if they've been in contact with someone that does have COVID, and thinking like that. But having those be systems wide changes are essential. So when we talk about policy, it's not, okay, only, this county in Ohio is doing it, but Cleveland's doing something else. Or only this health system is doing it, but another health system is doing something else. We know that those system wide, policy wide changes are essential for us to really get to the next step. And when we find something that works, we have to share it with our friends and our neighbors, in neighboring states, to really combat this. So it's sharing all those, contact tracing, hiring additional epidemiologists to monitor the diseases. We know that part of the biggest issues is that we were not prepared. We often in this country focus on tertiary care and not preventative care. We're always kind of playing catch up. And this time, it has just greatly infected our families, our communities, and our nation, or on our globe as a whole.
Right, right. One of the things you mentioned there, I made note of it while you were speaking because I was thinking along those same lines, is information and good information. Now, we've had a situation last week where 45 is standing up there, and now they're, it's kind of the reverse spin about, well, he didn't mean this or he meant that, whatever it may be. But nevertheless, we had someone in a leadership role in a bully pulpit, you know, throwing out, just thinking apparently stream of consciousness ideas about this could work, that could work. To me, it seems reckless to be doing that and suggesting that, and not, like, have your brainstorms off camera.
Yeah.
But anyway, I digress. I could go on a whole rant
And I
about
would say
that.
that even for myself, I have to be very cautious because people look to me for good and for reputable
Right.
information. And I have to make sure that I am providing that for the audiences that, follow me or actually know I'm in public health. So they're like, oh, I'm definitely going to listen to her.
Right.
So with those type of things, you cannot, it's very, if you do misspeak, you have to like admit it and say, wait, I want to take that back. I said that wrong. Because people are, especially in this, huge time of uncertainty, and we really don't know. You can't just say misinformation and just walk away from it and like it's not a big deal. People listen to leaders, of healthcare leaders, our policy, our senators, our governors, our state reps. People listen to those elected officials, right? So it's a responsibility to make sure that we speak the truth, that we know of.
No, I love that. And so along with that, we get, especially with social media these days, and we know, folks are at home more so, at least they should be, and typically they are now, on social media, these types of things, and we know how that goes. These memes get out there, these ideas that don't have any basis in reality, but just get repeated and take on a life of their own. One of the things I heard just kind of like scuttlebutt, and actually overheard it in a conversation at Kroger early on in this pandemic, where some African American folks were having a discussion and saying, "Well, no, we've actually heard that this doesn't. We're not affected by it. It doesn't. It doesn't apply to us, and so it doesn't matter. I don't have to do A, B, and C." And now we see with the outcomes that they're actually worse outcomes, right? So, for statistically speaking. So I think that's one of our challenges is, and when you have starting from the top, putting out misinformation or unsubstantiated information. But how do we do that? Part of this is, I think, how are we reaching people? How do we connect? Some people don't have computers and the internet and so forth. Where are they getting their news from, if at all? Or they're just hearing gossip and taking that as gospel and not gossip. It's a challenge. Do you have any idea? Do you have a sense of that? Or are there any ideas? How can we get more solid information out there from reputable sources?
I think we utilize the reputable sources that people listen to, right? I think early on we saw celebrities and actors and everyone saying they were sick, and then they were being perfectly fine. And think that gave the assumption that either we don't get it or we're not actually sick, because they were kind of glamorizing, like, this famous actor has gotten COVID, but he's on video and he's fine, so we're good. Like, in those type of, in this, it was really too soon to tell even at that point. But when you give a glimpse of like, oh, that's not us, that's a them problem. When it started impacting us, we were like, oh crap, like we don't know what this is. So I think it kind of hurt us. It helped us in the sense of like, now we know COVID is serious, but at the same time, it was too early to say, oh, well, I'm okay and I'm fine, because people's families were dying. You heard the stories about, mothers burying their children and their spouses. I mean, it's just insane. So I think we start to use those same, if people get their news from celebrities, I wouldn't advise it. Some celebrities are reputable. They look up their sources. Some do not. But if we feel like that's the way to get to various audiences, if that's the way, if, Instagram and Snapchat is how people get their news, we have to make sure that that news is reputable. And I know actually a lot of social media platforms are having, like, if you post something, it's not, everyone's like, it's censorship, but you don't want the wrong information out. So I mean, I guess it is, but at the same time, that is going to hurt our community as a whole before it helps it.
Right.
So I think that we have to use the platforms that, our communities are on to really be able to reach them. If you're not going to watch the news every day at 2, 3, and 4, then that's not where you're making sure you're doing that, but you're also making sure you're reaching social media. You're making sure you're putting on blogs and Twitter and things of that nature. So.
No, that's good, and that's one of the reasons I'm doing this series and having a number of folks from different backgrounds come on to share current information. As a matter of fact, tomorrow I've got Council Member PG Sittenfeld that's going to be joining us. And so we'll get some of the updates of the latest of what's going on with the city of Cincinnati and our outlook here. And so, in this very like small way, to try to help to get some information out to those that want it. Along those lines, if everybody would be willing to share this video to help us get the message out to even more folks, that would be great. So thank you for that. And also, again, just to repeat, if you have any questions, please drop those in the comments and we'll get to those. One of the things that I've also been, looking at, like I said, for folks that don't know me, I'm very engaged on a number of issues, but a couple of them being public transportation, active transportation, and we see how, a walkable type of lifestyle, rather than our sedentary car-based lifestyle has a number of impacts as well. And so, one of the things is I've been seeing photos from cities. Actually, I posted one on Facebook about 2 days ago from Nairobi, Kenya, where it shows the before, and the smog just kind of settled over the city. You couldn't even see it. And then recently, because of, unfortunately, all this reduced economic activity and everything that goes with that. But we know here, there was actually a report that came out just last week that showed in terms of particulate matter in our air, Cincinnati is 14th worst in the nation. We have some of the worst air quality in the nation here in Cincinnati. And the fact that the layout of our city, of the downtown area, is in a basin, it just kind of settles. But we've seen these photos from across the country and the globe where the pollution has lifted. Do you have any sense of kind of the background on that in terms of, in our urban communities, typically a higher percentage of minorities, typically a higher percentage of folks that don't own cars. In Cincinnati, it's over 20% of our households don't own cars. But yet we have even worse outcomes in terms of our air quality, which is kind of a sidebar to this, that's actually improving. Do you have any sense or concept on that in terms of the impacts of our air quality on the health of our communities?
Well, we've already seen in the short period of time the impacts of not driving and how the difference in our air quality on a short term. Obviously, we've only been stay at home for 6 weeks. Has it been 6 weeks? Something of that nature.
Yeah, something like that.
Yeah, 6 weeks. But we've seen it short term. But we know asthma, COPD, various lung illnesses are definitely associated with the air quality and the pollution in our community. And you're right. I never heard of it called a basement, but that is a great way to describe kind of how Cincinnati and downtown kind of sits. It is like a basement. And we often see that come out in people with, if you have any allergens, that's like the quick and easy way to think about it. But that pollution that's in our community is gravely affected. And we don't know for sure how COVID responds to that and kind of bringing the two together. We know we have some early indications of what respiratory illnesses in comparison to COVID. We know, COPD, asthma, but it's not definitive. If you have asthma, then you will, get COVID. But we know air pollution. We're starting to see and continue to research how air pollution is affecting us in this community. And I hope that after we, get through this pandemic, that it will have a light bulb will go off and we'll start to really think about transportation in our community and how we don't go back to the old normal and how we adjust to maybe continuing to care about our air quality and what that means for our community.
Right. Yeah, and those are great comments. As a matter of fact, we've got a couple questions that have popped up here. And along our current topic here, Joyce Powdrill mentions, what are some of the ideas that we can implement in Cincinnati to mitigate these environmental inequalities and adverse health outcomes from vehicle pollutions and so forth? Well, one of the things for me, for those that don't know me, I was a police officer for 26 years and have watched these impacts of traffic crashes have on communities. And just because our culture has always been so car-based, I think we've just kind of accepted that. We really have a pandemic of crash injuries and deaths every year, over 1,000 fatalities in Ohio, 35 to 40,000 fatalities nationally from car crashes. And again, we have this scenario where we've had disparate impacts in our minority and low-income communities historically, going back to when we had the interstates come through, and they were used as this kind of social tool to displace communities and all of that urban renewal, we're going to call it, to kind of whitewash it. So we've seen that. We've had this scenario here in Cincinnati where we've expanded Martin Luther King, the ironically named Martin Luther King Drive, to 10 lanes wide, but yet it goes through Walnut Hills, where there's a very high percentage of people that don't even own cars, and grandma can't even cross that 10-lane street to get to the other side these days. And so we've seen over the past number of years many, just a rash of pedestrians being hit, and then these health outcomes. So not to get onto that tangent too much, but I think one of the positives that we might be able to take away from this is see that those crash numbers, or while the COVID numbers are up, the crash numbers are down, the pollution is down, which helps that outcome. And all of these things tie together toward public health and safety in ways that we might not have considered.
Yep. And the only thing to add to that, it's, like you said, once it's over, what are we going to do? I saw pictures, someone was in Walmart shopping and they took a picture of all the bikes, and there were 0 bikes, like no kid bikes, no adult bikes. They were taking a video. They're like, I guess everyone bought a bike this year. But, how do we, before COVID, everyone was like, get out my lane. I need my lane. I can't ride the bike. This is the cars. This is not for bikes. So it's how do we continue that, right? How do we talk about bike safety as well? So right. I agree. Totally.
Well, that's so one of the things that we're seeing right now, I've been calling for it here in Cincinnati really for a long time, but in earnest over the last 6 weeks, because the vehicle traffic is down 60 to 70%. We have the space in the streets, but yet the sidewalks are this big, but the streets are this big, but now there's no cars. So perhaps, and we're seeing this in other cities, the city of New York just announced today 100 miles of city streets in New York are being closed down, except for local traffic. If you live there, that's fine, or your business is there. But for through traffic, we're closing it down. If you want to walk, bike, or whatever out in the street, that's a public space shared by all modes of transportation. And so we're seeing that a city in South America, Medellin, Colombia, just announced today they already have 1,000 miles of bike lanes, and they're adding X number, 100 miles more. Again, with this whole notion of, since we're not driving as much, we want to actually incentivize people to walk, to bike, the positive health outcomes of that, which also helps the pollution. So we can work on a number of those things to answer your question, Joyce, from a policy perspective here in Cincinnati, and it's just changing that mindset of how we look at our transportation systems and emphasizing bikes and pedestrians and public transit and those types of things. And then it turns out, that's our critical workers that work at Kroger and CVS and Walgreens. They depend on that more than anybody, and we depend on them. So we need to support these things. Now, I'm guessing that Ivy Hardee is a relation of yours, based on the spelling of the last name.
Always coming through.
She dropped a comment here, which I think is good, because you'd mentioned contact tracing, which is kind of a fancy term. So maybe I should have stopped you and said, can you explain that? Can you tell us more about what contact tracing and what that means?
Yeah, contact tracing is pretty simple in the sense of, really, after you are diagnosed with COVID-19, we want someone to walk through, where have you been? Because if we know that you have been to a local business, we can then inform that business, find out who did you come in contact with? Was there anyone, were you close to anyone? It's really kind of like a long-term interview that we were able to then go back to the next person and saying, where did they go? Now, it's sometimes considered scary. It should not be. Really, it helps us really identify if a person becomes ill, maybe the person they got COVID-19 from, or if they then spread it to someone else.
Right.
This is essential. This contact tracing, I think, is going to be so, so important as we continue down this path that's stay at home. We will not be able to really combat COVID-19 if we do not focus on contact tracing. Because what we do know is that people are still getting COVID-19. We have not seen a reduction in our cases. What we need to know is if you become ill, you test positive for COVID-19, now we go to work and we go and see, who did you come in contact with, who have you been around, make sure your family is tested. As we now start to get more tests, we have more access. We can talk about social isolation, what that means. So it really is kind of like our step one. We saw it in a case in Chicago, and they were able to trace the family had went to a birthday party and a funeral, and they literally were able to show kind of a graph. And I can link it in the comments of the article after we're done, because it's really interesting to look at how we were able to see they went to this party together, and then 3 of them got sick out of the 10 that were there, and then that person went to another party, and then they went to a dinner at someone's house, and 5 of them got sick out of the 17 that were there.
Right.
But that helps us really start to then say, okay, well, did you test positive? You need to be hospitalized. We're trying to make sure that we reduce morbidity and mortality with COVID, but we don't know that when we don't know who you're around or how you got sick. So that is contact tracing as a whole.
So, and I think that's where we need to be with really building out that capacity, and also testing capacity that we haven't had. So we don't even know who's positive to then trace to a substantial degree. And I think, and this is just me editorializing a little bit, where we've really dropped the ball, especially at the federal level, because it was being ignored. It's not a problem. We were told it was a hoax and it was one guy in China and whatever, until finally they couldn't ignore it anymore. But we look at, and one of the things that concerns me, as a resident of the urban core of Cincinnati, and just somebody who loves cities and just urbanity in general, that there's this notion out there, well, it's because of these density. That's the problem. If we all lived out in the country someplace a mile apart from each other, but yet we look at cities in Asia who've been dealing with this, over a number of years, different viruses. And there's a place like Singapore, for example, or Seoul, South Korea, cities with millions and millions of people, very dense cities, but yet they don't have the problems that we have. And so you look at the infrastructure, the health infrastructure that we already touched on, that's just so lacking here, number one. And then number two, if from in that December to March time period, our federal government, instead of ignoring it, had said, you know what, we could be facing a real crisis here. And so therefore we need to build out, if they had actually talked to the professionals and listened to Dr. Fauci and people like Dr. Hardy and others, we could have been building out the capacity. It's the most richest, powerful country on earth, that testing capacity, so that I can test. If you're positive, we need to know everybody that you've been with in the past or close to in the past X number of days, and then we're going to quarantine you. And then that way, that's how we contain it. And we've ended up with this situation where people now are becoming more and more upset about the economic impacts, because we just had to quarantine everybody because we had no idea who was positive and who wasn't. If we would have had the capacity that exists in this world to test, contact trace, and then quarantine positives, we wouldn't even had to have done all of this. Am I right on that?
Oh, you are so right. I remember when it started to happen, and I was having a conversation, and I said they were recruiting public health people for this in December. And I was like, I'm not crazy. I remember a recruiter reaching out to a public health group and saying, does anyone want a job working on COVID-19? We're like, oh, it was actually at airports. So public health knew about it. I don't doubt that they were saying it at a national level. They had to have been. We knew other countries. We watched what happened in Italy. We literally just watched it happen. And there was nothing done here until it was impacting us. And I think that was our biggest mistake. We could have started to limit gatherings. We could have started to, make impacts and have warnings or have face masks or anything earlier. But, mid-March, we were like, uh-oh, like everyone shut down. When really it should have been, we should have started 2020 with this is a problem and this is how we need to solve it. But I think it was that unknown. It's the unknown that it was like, oh, it's not that serious. And here we are. So.
Right. Well, we've got it figured out. I mean, if it is to listen to us, we'd all be better off. I joke, but kind of. So with that, where do we go from here? We talked a little bit about it. Some of this, I don't want to get on too big of a political rant, but obviously public policy, ends and begins with, with elected leaders. And so, I don't know how much is going to change, but I'm wondering a little bit about, especially, today we had the governor's announcement. We're going to start to slowly open things back up. I think there was a sense out there that people just thought May 1 was a magic day and we're just going to flip a switch and just go back to how it was. But clearly, at least in Ohio, that's not happening. It's going to be a measured roll. And then we'll see. We just don't know yet as we start to do this. Is there going to be a spike or not? We don't know. So do you think that's a reasonable step? Now we've seen, I guess we'll find out what happens in some of these other states that are just saying we are going to do that. What's your sense of that?
Yeah, I think I'm scared. I don't necessarily think it was the best decision to open states when still we know that, well, from my understanding, those states do not have enough tests to test every single person that may have symptoms. Mm-hmm. And that's the issue, right? If we don't have enough tests, we need to have enough tests if everyone gets sick. In the beginning of this, the reason why we shut down is we don't have enough ventilators if everyone needs a ventilator. We don't have enough healthcare, even though in everyone's minds they think that we have a lot of healthcare. We really do not have that many beds when you think about our population size. So I'm worried, and I'm sad for those other communities that have not taken a public health first and thinking it's not worth it. I understand that we are all going through economic hardships right now. The good thing, the good quote unquote thing is that we're all going through them. So everyone is impacted by this. No one is, well, I don't know if anyone's profiting, probably all the virtual,
virtual. Yeah, the big way. Somehow it always flows up I don't know how that happens.
Virtual, whoever's helping us connect, they're profiting. Other than that, we're all impacted gravely by this. But I think it is putting people in positions, when we think about elections, it is so important to think, maybe we don't want this to happen again. Let's talk about what prevention looks like in our community. Right. And from top to bottom, right? So I think we all can take up okay, maybe I do need to, get healthier, eat healthier, be more active, right? That's a personal thing that we can work towards. But also, who am I putting in who are my elected officials that I'm voting for in November? What's really, really important here? And when we are starting to see that now that we're at home, we're spending time with our families. And because of that, we're like, wait, where's the core? Where are my core values at and what's important? My goal, most people at the core, they're like, I want to spend time with loved ones, family members, etc. So those type of things are what we need to think about come election time, or when you're thinking maybe I should run for office, or you're thinking maybe I should serve on a committee for a civic board. So all of those things are super, super important because this is going to be, you talk about normal. The normal as we know it, I don't know when we'll see that normal again, because it is not just a flip of the switch. We're automatically going to be able to go back to being in large rooms with a ton of people. It does not look like that's going to happen anytime soon. So what can we do? What impact can we all take personally and make going forward?
Well, and I think that's one of the biggest takeaways that we might gain out of this from a positive perspective is that all of these things that we weren't doing, hopefully more people recognize that now. The importance of all this, and to kind of bring it full circle. Social determinants of health, all of these things are impacting us over the long term. And so hopefully now more people are ready to engage in change in that way, and positive change, and kind of raise this up the, kind of the flagpole in terms of importance, and how much attention that we pay to some of these things that folks like yourself have been, working at times in the background, or sounding the alarms as they were in December, and not being paid attention to. And so hopefully we make some change in that regard. So with that, those very wise words of yours. Thank you. How can people get in touch with you if they want to reach out? And then also, you do some consulting work, right? On your website and stuff, your contact information. What are those some of the other things, and how can we engage you in that way?
Yeah, so on all social media platforms, I'm Dr. _Hardee. So it's Dr_HARDEE. And then my website is Hardy.com. So someone stole the DR Hardy, so I couldn't keep it the same. Consulting, I really not see myself. I work primarily on needs assessments and action plans. So I'm in a health strategy position at the AHA, and I help other organizations really try to come up with an action plan and strategize how you work on various health priorities. So from things as tobacco, hypertension work, worked in global health, obviously have a wealth of experience in that, as well as epidemiology and a host of other things. But I'm really passionate about kind of strategizing, and then obviously leading to policy systems, environmental change. That's where we know the largest impact, the largest long-term impact of our work is. So how do we, even though it's long and it's stressful sometimes, and it's a lot of conversations to really get our policies and system change and environmental changes through, but they are so important, and they're bigger than us, right? They're bigger than what I may see in my lifetime, but thinking about what the future of the community looks like, and how do we continue to strive to working towards that. So even if I don't see the change, someone in the future will be able to.
No, that's fantastic. We're so really honored to have you here. I'm glad that you've apparently adopted Cincinnati as your hometown now, down from Cleveland. So you're a great asset to our community to have you here, and obviously by the comments that you've gotten on here, people love you. So thank you so much. Thank you for joining us this evening, everybody. Derek Bauman, you get a hold of me at Derek Bauman on just about every platform. Please follow, share, all of those kinds of things, and help to get this correct, real information out there. And Dr. Hardy, thank you for joining us this evening. And with that, thank you. Yes, absolutely. Go ahead.
Have a good one.
All right. Thank you so much. Cincinnati, love you all as always. Peace. Thanks, everyone.